Hello everyone, this lecture is for Monday, June 22nd. So when we hear about these challenges of a student, the social challenge, the emotional challenges, and then the behavioral challenges that you read about in the textbook, you want to make sure that you think about them as three distinctive or different challenges that students may face. So on the screen I've put the federal definition for an emotional disability, emotional or behavioral disorder. If you read this definition and you think about the inability to learn not related to other factors, the inability to build or maintain satisfactory peer or teacher relationships, inappropriate feelings or behavior under normal conditions, and you read through those other ones, how do you feel about this definition? These were probably some of the things that you're thinking, that the definition is vague, or actually it could be subjective. So what does satisfactory peer and teacher relationships look like? And what does inappropriate behavior look like? The definition as written excludes children on the basis for which they are included. So how does one differentiate between socially maladjusted and a true emotional disturbance? So individual teacher expectations and tolerances make identification a difficult and subjective process for the emotional and behavioral areas. The two primary behavioral excesses would be externalizing behavior and internalizing behavior. If we look at the most common behavior pattern, which is that external behavior, lying, temper tantrums, stealing, property destruction, threatens violence towards peers or teachers. And the internalizing behaviors will be the shy, withdrawn, hypochondria, easily upset, or difficult to calm. These are sometimes behaviors, sometimes are more often missed. So here are some behavioral deficits when you look at academic achievement and social skills. You have high absenteeism, at risk of school failure and early dropout, low GPA. Social skills, the students have lower quality peer relationships, less participation in extracurricular activities, and a high tendency of research show that they are participating in juvenile delinquent type behaviors. So we are looking at the prevalence of EBD and the students with EBD, and estimates do vary, the textbook research, but it's about 8.3% of school-age children. So if you look at this, then that means that there are many students that are not receiving specialized services. And the vast majority of students that are identified as having emotional and behavioral disabilities or disorders are boys. According to research and your textbook, if you look at the biological factors and environmental factors, brain injury, genetics, temperament, home environmental factor is a big one. Inconsistent parenting practices, lots of different things happening in the home or outside of the school. School could be teacher actions, ineffective instruction, and then the community, drug and alcohol abuse, and of course gangs is in there. Identification and assessment, we use screening tests used to determine what intervention is warranted. Behavioral rating scales or checklists, direct observation and measurement, directly focusing on the child's problem, and useful for educational planning and making the choices of the interventions that are necessary. So we're looking at these students and thinking, why did they do that? So Jim frequently makes jokes in his science class, but Mr. Schrute, when he gives a demonstration, Jim's friends laugh at his jokes and the teacher gets upset, raises his voice and says, "Excuse me, can you be quiet?" he says sarcastically. So why did Jim do this? The next student's Meredith. It's reading time in Mr. Bernard's class, and Mr. Bernard asks Meredith to come over to the reading table. Meredith doesn't like reading groups, so she just goes to the computer instead. Mr. Bernard gets mad and says, "Meredith, go to the office. You aren't following directions." Why did Meredith do that? Finding out why a student did something is called finding the function of the behavior. In a functional behavior assessment, which is a systematic data-driven process, we can discover why a student behaved a certain way or a certain behavior was exhibited, and then we can teach the student the correct replacement behavior or help the student with decreasing or increasing the behavior that we would like to see in the future. Here on the screen you see informal assessment. This would be checking out the records, parent interviews, teacher checklists. This is where you're gathering the data to help you figure out the function of the behavior. Direct classroom behavior, direct observation and measurement, and then all of these data are helping you with your hypothesis or developing the intervention based on the probable cause of the behavior or the function of that behavior. The identification of the function of the behavior, you ask yourself, does the student get something that he or she wants out of this behavior, or does the student get out of something that he or she dislikes? When we look at the intervention process, we are teaching functional replacement behaviors. So what appropriate alternative behavior do you want to teach to replace the problem behavior? And then in the end, we evaluate and modify. Data are collected to determine the success of what you have completed and then modify as needed. So if we go back to the example of Jim, what's the function of Jim's problem behavior? We ask ourselves, did Jim get out of something that he or she dislikes, or did he get something that he wanted? In this example, he gets attention. He gets the attention from his friends and also from his teacher. So what would be a replacement behavior that we could teach Jim for getting that attention from his teacher or his peers? If we take a look at Meredith, does she get something she wants, or does she get out of something that she dislikes? When we ask ourselves those two questions, we see that the function of Meredith's problem behavior is she is escaping reading time. So, what replacement behavior could we teach Meredith? If we look at the ABC from the textbook, and we look at the antecedent, the behavior, and the consequence of behaviors, we can look at this example. Caesar dyes his hair 3 colors and is teased several times by his friends before class. When he enters the class, his teacher stares at his hair. Caesar immediately says, "What are you staring at?" and his teacher sends him to in-school detention. So if we look at how this would be set up, the setting event, or what happens to Caesar, is he's teased about his hair. So then when his teacher stares at his hair, what happens, or the behavior, would be that he asks his teacher what she's staring at. And then he is immediately sent out of class. You see how it's important to not only know what the behavior is, but what happened before the behavior, the antecedents, the setting events, the things that happen before the response or the behavior, to see the actual function of the behavior. And if we look at the function here, Caesar is trying to escape the attention. So whenever you are thinking about reducing a problem behavior, you need to identify the behavior that you would like to performed instead of the problem behavior. So if you have a student that is blurting out in class and you would like to decrease that behavior, the identifying the alternative desired behavior would be for the student to raise their hand. So do not try to reduce a problem behavior without having a backup plan or a alternative behavior that you would like to teach that student. So here we have a summary statement and a flow chart. If this helps you look at the ABC chart a little differently, breaking down the setting events, what happens right before the problem behavior, what your desired alternative is, and looking at the consequences of behavior. Here is an example of a ABC chart or competing pathway behavior filled out in the example with Caesar. So there are 6 complete steps of completing the functional behavior assessment: identifying the problem, collecting data using multiple assessments, analyzing the data, making your determinations and hypotheses, develop and implement a behavior implementation plan, and then evaluating your progress and follow up as necessary. Step 1 is to pinpoint the behavior that causes the learning or discipline problems, and you define that behavior in concrete terms. And what that means is you have to be able to communicate this, and it's easy to measure and record. So if you identify the problem, it has to be something that you can collect data on or observe and see so that you can see how many times this is occurring. So if we look at Dwayne, Ladane, and Kendra here on the screen, Dwayne is disruptive, Ladane is disrespectful, and Kendra is slow. So how are these actually problems? They're not defined concretely. We have no idea what disruptive, disrespectful, or slow actually mean. We can't observe this, we can't measure this. Important factors to look at when we are identifying deficits is a skill or a performance deficit. A skill deficit means that the student does not know how to perform the skill. A performance deficit means that the student knows the desired skill but is unable to perform the skill on a consistent basis. A very important question. Is the problem behavior linked to a skill deficit? Remember my example of reading down the row? Is there evidence to suggest that the student does not know how to perform the skill and therefore cannot? And does the student understand the behavioral expectations for the situation? Another important question is, does the student have the skill? Sometimes they do have the skill, but they can't use it consistently. It's possible that the student is uncertain of the appropriateness of the behavior. For example, is it appropriate to clap loudly and yell during sporting events, yet those are inappropriate when playing a classroom game? It's very important that we address skill and performance deficits by recognizing the physical signs that the student is becoming angry. Use relaxation skills, apply problem-solving skills, practice communication skills, modify what you need to modify, and then utilize your support staff. You want to make sure that you're collecting data using multiple assessments. It's very useful to compare the interviews of adults who have direct contact with the child and the child himself in order to gain perspective of those things that may be similar in nature. That's why interviews are very important for a multiple assessment, because you don't just interview one teacher or adult, you want to have multiple. When you are doing the interviews, here are some important questions to think about. going back to that ABC or the competing pathway summary or the flow chart, whatever way works for you, whatever measurement works for you in that direct assessment. You are observing the problem behavior and describing the conditions that surround the behavior. Here's an example of a scatter plot that show 5-minute increments of when this problem behavior may occur. This is a way to collect data on when a student does exhibit the behavior, or it could be time when the student does not do a certain type behavior, depending on what type of function of behavior you are looking at. Using those multiple assessments, collaborating together, provides essential planning tools for making your behavior intervention plans. So once you've done step 1 and step 2, you've identified the problem, you've collected your data. Now you're going to carefully examine what you have learned about the behavior and the context, compare and analyze, identify patterns, and then revise your assessment plan. Make determinations about what to do next. Use the information. Look at the antecedents and the consequences as well as the reaction to the consequences. This is all about the student. We're trying to help the student with those externalizing or internalizing behaviors that we really need to target for them to be successful in academics and socially. So you want to make sure that you are testing your hypothesis. For example, if a student calls out during instruction, the FBA might reveal the function of the behavior that it's attention-seeking behavior, or to avoid instruction, or to seek an excitement, or to gain both attention and avoid a low-interest subject. So what is the function of Daryl's behavior in those particular settings? And you're going to have to develop this plan as a team and then implement the plan. Every plan is not going to work perfectly from the beginning, but you are going to manipulate the antecedents and consequences of the behavior, teach acceptable replacement behavior, implement changes, modify the environment. You have to, make the modifications necessary. You have to evaluate what you are doing as well as what the student is doing. That is why you must monitor and collect data on a regular basis. Decisions must be made as a team for what is working and what is not working. Evaluate. We say that you want to evaluate the fidelity of which the plan has been implemented, and that means did you do what you say you were going to do with faithfulness to it. It is very difficult sometimes to be consistent with students when there is a difficult problem behavior, but that is as important in this data collection process as the data itself. So evaluating the changes in student behavior, modifying the plan, and continue planning and warranted, and develop phase-out program as appropriate. Again, here are the 6 steps of a functional behavior assessment. And here is a case study on Jaron. If you were to look at this for a case study and using the 6 steps of FBA, identify possible interventions for each step and be as specific as possible. While we're not having class tonight, it's still a good practice activity for you guys to do. He's failing 3 classes. He does not complete his homework, rarely participates in class discussion. Jaron is not outspoken, but he tends to get verbally aggressive when his teachers ask him about his work or when he's confronted by peers. Jaron's mother reports that he is helpful at home and always been a quiet child. So go back to those 6 steps of the FBA and identify some interventions that will help Jaron at different phases. You will have students that you interact with that are a lot like Jaron. While this does seem like a lot of work, the functional behavior assessment is a tool that is used to make decisions about why behaviors are occurring. It's necessary to change behavior. We have to do these type things. You have to be consistent. This is very important for students. So I thought that it would be important to go back to the ABCs of functional assessment to just summarize what I have talked about. I've given you several different examples, but to break it down at the easiest level is the ABC. A, the antecedent, what happens before the behavior. The behavior is the specific description of the behavior. And then the consequences, what happens after the behavior occurs. And because we love a graphic. Here's an example of an ABC, or functional assessment. The antecedent is what happens before. The behavior is what is the specific behavior described in measurable, objective, observable terms, and then what happens when the behavior occurs. I used a real life example here because sometimes we do get very caught up in it has to be a negative behavior or some type of behavior that requires, or a consequence is always negative. So I thought it would be good to look at this one. When we look at students with EBD, we want to make sure that we approach their curriculum goals. Things that help students with academic skills are direct, explicit instruction, high rates of teacher praise. Social skills we focus on are cooperation skills, appropriate ways to express feelings, and responding to failure. Behavior management with students with EBD, we want to have positive, proactive classroom management strategies, and most importantly, positive behavior support. Focus on building up those appropriate behaviors, not just punishing the problem behavior. Work at the individual classroom and school levels of making sure that we're promoting that positivity. Got a couple examples of positive behavior support. We're going with thumbs up if it is, thumbs down if it isn't. Just going to go through a few examples. Stanley gets sent to timeout every time he talks out without raising his hand. Thumbs down. When his class does not follow directions, Mr. Vance moves the class marker to red zone on his classroom behavior chart. Thumbs down. Miss Beasley gives Michael a point on his chart every time he raises his hand quietly without shouting out. Thumbs up. The school principal, Miss Levinson, gave Mr. Bratton's class an extra 5 minutes of lunch recess when she saw them walking quietly and respectful in the hallway. Thumbs up. See how these examples of being caught doing something good are positive. We're finding out what you're doing right and pointing that out. That's a good way to look at positive behavior support. Other curriculum goals that we look at for students with emotional and behavioral deficit. As a teacher and someone working with students, you want to also focus on other variables that could be contributing to this. Teachers should focus effort on only those variables that make a difference in student learning and can be affected by sound teaching practices, however. If we look at the educational placements continuum of services for students with EBD, 40% of them receive education in separate classrooms, special schools, and residential facilities. Most students receive special education because of emotional or behavioral disorders, have serious problems that require intensive intervention. Next, we will look at ADHD. The essential feature of ADHD is that persistent pattern in inattention or hyperactivity and impulsivity. Students in exceptional children are served under the category of OHI, or other health impairment. ADHD is not considered to be a disability category under IDEA. Estimates of the children range from 3 to 5% of school-age children. The two treatments for ADHD that are widely used are drug therapy and behavioral interventions. The symptoms of ADHD. The severity. The symptoms are more frequent and severe than other children. Early onset symptoms appeared before age 7 and they stayed for longer than 6 months. While it's not really important for us to know the different types of ADHD, whenever you are reading evaluations and psychological evaluations, these are the type terminologies that you may see. However, classification based on symptoms of we find that of little use in educational planning. For no other group of exceptional learner is the continuum of educational services more relevant. Characteristics of ADHD: young children, it's excessively gross motor activity. Elementary, it's restlessness and attention. Adolescents, low self-esteem, behavioral problems. Adults, job problems, social relationships. These are general categories of characteristics. Two important factors that will affect the educational needs of the children are the age of onset and the visibility. So, while students may receive services for special education under IDEA for other health impaired, they may also receive services under Section 504 of the Rehab Act of '73. This differs by one simple statement. Does the ADHD adversely affect their educational performance and need specialized services? That would be an IEP. If it does not, and the students just need specific accommodations to help them be successful, that would be a 504. These data stop at 2008. However, I just want you to see the increase of students with other health impairment and how that has increased significantly since the early 90s. As a teacher, discussing medications with students can be very uncomfortable or sensitive. You will know the medications that your students are on if you receive those psychological reports. If the student takes medicine at school through the office or someone else who is medically certified to give medicine, you want to be very careful in these conversations. Never suggest that a student needs medicine. None of us went to medical school, nor can we diagnose or give psychostimulant medications, so never recommend medicine. Even though you may believe 100% wholeheartedly that Ritalin, Adderall, Concerta, Focalin, or these medicines may help a specific child, you are not a doctor and cannot prescribe them. So be very careful in these conversations. Not only for your protection and safety as far as overstepping boundaries, but also being sensitive to the fact that the parents and student perception of medicine or therapy for ADHD, because it is a parent's choice if they choose to put a child on medicine or they use behavioral therapy type activities, and doctors recommend different things when they see their physician. So I'm just giving you advice of making sure that this conversation is never directed by you saying that a child needs medication. This is the neurotransmitter system picture that was in your textbook. I thought that it was an interesting graphic, a good way to look at how this system actually works. And finally, some evidence-based strategies for teaching students with ADHD would be looking for those evidence-based practices around increasing their attention, managing the impulsivity, and then reducing the hyperactivity. And that leads us to our undergraduate article assignment. So if you're interested in looking at strategies for teaching students with ADHD, these would be the 3 areas that you could focus on in your area of interest. So what's really neat about this undergraduate article assignment is that you are going to come up with something in the regards of learning disabilities that interests you. Is it ADHD? Is it autism? Is it a disability category that you've talked about? Emotional behavior disorders, something that we've talked about in class, or is it just an area of interest in learning disabilities? You want to know about specific interventions that increase reading, specific interventions that help students that have reading comprehension issues, writing deficits, what modifications are best suited for assistive technology for a student with ADHD. I'm just throwing out examples. Please come up with something that interests you. However, our textbook is very valuable, but we are going to look at journal articles. They have to be a journal article from 2005 to 2015. You can include anything that we've covered in class, something from the syllabus, excuse me. If it's something that you're unsure of and you want to run it by us, just shoot us an email and we can approve your topic. You will do 2 journal article reviews. That means that you will find 2 completely separate articles, but they have the same topic. For example, if you are interested in reading comprehension interventions, you would come up with 2 articles discussing reading comprehension interventions. You do not use newspaper articles, you do not use a magazine, you do not use a video, you do not use conference presentations. They have to be journal articles. You will have to use the search engines in the school library through ERIC or EBSCOhost. You can go onto the library's website and it will help you. You can try Google Scholar trying to find these articles. If you are unsure of a source, ask. Do not use something from the internet and think that it is appropriate without asking, unless it is a journal. For example, the Journal of Special Education, Exceptional Children, those type journals are appropriate. Learning Disabilities Quarterly, there are lots and lots and lots of journals that you could use for this assignment. So if it is a journal that comes from our field, use the correct APA citation, but do not hesitate to ask if you have a question about the journal itself. So your responsibility for that article summary is you are going to write the title. That is your interest area. That is not the title of the article. So if you are looking at reading interventions, that's what you would put there. Title, reading interventions. Your name and the date. The date is the day that it is due. Number 1 is the APA citation for your article. Number 2, you are summarizing at least 3 key points in the article. If you have chosen a research study to use for your article, then you will describe the purpose, procedures, and population described in that journal article. Number 3, respond to the article confirming or refuting your perceptions gained from within or outside of this class. That means, what did you learn from this article? Did this confirm things that you already knew, that you learned from this class, or you've learned from your profession? And then explain that. And then, what questions or comments do you have for the author of that journal? If you don't have any questions after reading the article, then find another article. You need to have questions or comments for the person who wrote the article, because this is an area of interest for you, so something that you read should spark a question. And then lastly, my future. How can this data or idea from this journal article be used in your own teaching or personal mission statement moving forward? It's important that you learn something from this article, that you gain information that you're going to use in your future to impact students and to impact your career. So what are those things? And you will do this two times, 2 articles in the same interest area.